correction. All right, our first correction is for a high ilium. And I'll show you two ways to correct a high ilium. So door number one would be this side lying variation where she is lying on the side that is high. So she had a high right ilium, she's lying on her right side. And this is kind of along your classic MET articular correction. But you may want to choose door number two, which I'll show in a bit, for clients who have a hard time with a combination of flexion and internal rotation of the hip joint. So step one for this is that we will palpate the spinous process of L5. And I'll just come back here. You come to the sacrum. So we want to palpate the spinous process of L5, which is very close to the sacral base. Then you slide both thighs into flexion until you feel that spinous process rotate. And on most everybody, that's at about 90 degrees. So, Janet, I'll be doing this for you. You don't have to do a thing. And there, I felt it move. So that's our positioning that we would begin the correction from. Then I'll lift up her ankles with my forearm. And she's passive right now. So what is the end range here? Well, this is her end range. I want to take it to the end range, then slightly back off. My uphill hand is going to gently press this pelvis, top side of the pelvis back, because the tendency for most people is to roll forward. So this is preventing that roll forward. So I go to end range, slightly back off. Now, Janet, let's both take a deep breath. And on your exhale, you're going to very lightly press your ankles down into my forearm. Good. Little less, little less. Good. That's good. Hold. This is an 8-second hold, or really anywhere between 5 and 10 seconds. And relax. Take a breath. We both breathe. And here's our post-isometric relaxation breath. Now we'll go to the next end range. Janet, you don't do anything until I tell you. So you see how we got much more joint play there, which is what we want. And we just hang out at this new end range for about 3 deep breaths. 2 to 3 deep breaths is fine. Now, one thing a lot of clients will do is they'll attempt to straighten their knees. So you're just going to have to cue them that the proper movement is just a simple press down with their ankles into your forearm. And you can go ahead and do that, Janet. 5, 6, 7, 8. Relax. We both take a breath. And then we move to the new end range. So you notice how I'm in a nice squat. I'm protecting my low back. My scapula are anchored, so I'm not into a protracted, what I call a bulldog position. I'm protecting my body. This is really easy on my body, but for some clients, they may feel pain in their hip joint. So that's why I have a door number 2 variation to offer you. And let's do that one more time, Janet. On your exhale, go ahead and push down. 2, 3, 4, 5, 6, 7, 8. Relax. New end range. So you want to bring her slowly out of the position after that last correction. The slower the better, to give the myofascial structures time to digest. So you would reassess after you've done all your corrections to make sure that they've either had a full correction or a partial correction.